Have you ever wondered why so many historic black hospitals exist across America? Because for decades, the rule, spoken or unspoken, was simple. Many hospitals treated black patients last, or not at all. Black doctors were denied hospital privileges. Black nurses were denied training. Black patients were often turned away from emergency rooms. So black communities did something powerful. They didn't beg. They built their own hospitals. The first brick of resistance. In 1891, a brilliant surgeon named Daniel Hale Williams made a bold move. When white hospitals refused to allow black doctors to practice, he founded Provident Hospital of Cook County. It became the first black-owned and operated hospital in the United States. But it was more than a hospital. It trained black doctors and nurses who had been locked out of medical schools and residencies. And in an incredible moment of medical history, Provident hosted one of America's first successful open-heart surgeries. More than a century later, the hospital still serves Chicago's South Side, healing after slavery. Even earlier, in 1862, another institution opened during the Civil War, Freedmen's Hospital. It was created to treat newly freed enslaved people and black Union soldiers. But its impact didn't end with the war. Freedmen's Hospital became the training hospital for Howard University, producing generations of black physicians. Today, it lives on as Howard University Hospital, one of the most important medical institutions in black history. Community hospitals that saved lives. Across the South, similar hospitals emerged. In 1917, the Aiken-colored hospital opened to care for black patients denied treatment elsewhere. Built by the black community, it became a sanctuary for families who had nowhere else to go. And in 1952, Good Samaritan Waverly Hospital opened with 50 beds, laboratories, and training programs for black nurses. For decades, these hospitals saved lives in communities the healthcare system had ignored. The architecture of survival. These hospitals were more than buildings. They were acts of resistance. They trained black doctors when medical schools refused them. They treated black patients when hospitals closed their doors. And they proved something powerful. When the system said, "You're not welcome," black communities answered with determination, "We'll build our own." Subscribe and comment Black Doctor if you'd like to hear more hidden stories about black medical pioneers. We don't glorify injustice, we reveal truth so history can't repeat itself.